The reason is, first of all, we have 4 major HMOs that cover social security, healthcare services for everyone. It is mandatory, obligatory for every person at the age of, from the minute it's born actually, to enroll with one of the HMOs. So all the systems and all the information is completely digital. We have fully digitalized EMRs and centralized for every single person which is part of the population, which is extraordinary. This gives central control. Those HMOs and the hospitals have, under the recommendation and the direction of the government, opened field hospitals and field clinics to run this unbelievable operational inoculation of the whole population. So you have people who have access to a digital platform that was created just a month before all the vaccines have arrived to Israel. They have enrolled a whole number of people. Anyone above 60 years old has been put on the schedule straight away. So people have every 6 minutes, a different person is vaccinated. I personally got vaccinated almost 2.5 weeks ago, and my second vaccine is coming up in a few days. I was booked for 11:32 in the morning, which is unbelievable, right? Every 6 minutes, someone comes in and gets a vaccine. All the information is stored in a centralized HMR and is then dispatched through to the HMOs for follow-up for the second vaccine. It's a fantastic rollout, really, very organized.
Sigal, I just wanted to run through that with you because I thought that was really interesting, because at the end of the day, I mean, you're saying that the HMOs were the reason that Israel really was able to tackle this so quickly. In terms of that vaccine rollout. Here in the region, obviously, the Gulf Arab countries, monarchies, it's easier when it's a top-down system. Right now, the government here in Dubai, for example, obviously getting together and making that vaccination or making vaccines available to the public, saying that healthcare or that government workers need to have them as well. But when you think about that with regards to what's happening in the broader West, I mean, serious issues in the United States with rolling out a vaccine. In the UK, they're doing a bit better job, as you know. That just highlights the difference, doesn't it? I mean, is this something that you think that is a possible, can we address that, do you think, in the Western world in a different way? I mean, seriously, by state, that's just really not worked for the U.S., at least so far.
You're very right. It's a huge challenge, but in every challenge, there's a very big opportunity. So if you look at Asia, for example, and Medix has been working in over 90 countries across the world, with 12 different offices, so we really see what's on the ground. In Asia, you don't have those HMOs. In the US, it's mainly private systems. The UK has the NHS, but has been quite slow and not organized enough. So if I could recommend for places like Hong Kong, Singapore, what they should do is, first of all, get your population on a database. From that database, create an app, a simple option of booking people into scheduling their vaccines, put up field clinics, and make sure you have priorities with who gets in first, because at some point everyone wants to get a vaccine, and that becomes it could be quite chaotic.